You want to talk to her? I'll get her on this phone call. I mean,
But we're speaking with you, that you don't tell them to call the physician's office. We have nothing to do with this. You guys are you're doing the wrong thing. My name is Julie. I'm the practice manager and the bathroom monitor. And my title, we're getting, I would say, close to 50 denials a week. Yep, my last initial is B as in broomstick. And if you think Claudia had a bad attitude, you're going to love me. We do what we can do, and then I pivot to public shaming on social media. We have 17,100 followers on TikTok. I have emails from Aetna saying, get off TikTok. Cigna sent us a cease and desist letter. How can this little tiny practice in Bridgeton, Missouri get underneath the skin of multi-billion-dollar international company Cigna? We must be doing something right.
My body is in constant pain. Everything swells. I can barely sometimes walk. My ankles hurt so bad.
I don't really think anybody that doesn't have it gets it. The popping and cracking of the bones every time you do something, the exhaustion, the brain fog.
I was literally on this sofa for 2.5 weeks. And when I say literally on this sofa, I could not get up.
My regular doctor sent me to the arthritis center. He said, you've got rheumatoid. After my first infusion, I woke up and I was like, oh, my back's not hurting. Oh my gosh. I think I finally found a medicine that's going to work for me. And from then on, I just started to feel better and better. And then I got that letter. How do you deem something medically necessary for 3 treatments? And then you drop it.
We work extremely hard to care for patients that are really sick. The biggest barriers for me are straight up the insurance companies and their pharmacy benefit managers. These are interlopers that are standing in between the physician and the patients. They have no business making clinical decisions.
I'm a corrections officer, and several years ago I began having pain. I was having a lot of trouble at work, trying to get through the day. When I came here, they were able to get me diagnosed and get me on a regimen. It was really a game changer. Then my employer decided it was time for them to explore changing insurance companies. And it was instantaneous that I went from having insurance that I was never questioned. It was just blatant, no, you're not going to get what's helped you.
It's difficult for me to take somebody who's doing well on anything and swap from one drug that's supposedly the same to another drug that's got a different name and people don't do well. It's a really, really big problem.
We'll do whatever it takes to get the right drug for the right patients. We appeal absolutely everything. It's not uncommon for me to spend 100 hours trying to get a case overturned, and I don't think that most physicians' offices have the bench strength and the tenacity to do that because it's hard.
I ran a couple of federally qualified healthcare centers. I am a healthcare administrator. Even for me to have a practice management background, to know the whole course of having to file an appeal, how to do it, right? You just get exhausted. So when Julie calls and said, hey, listen, we can help you do this appeal, I called my husband and said, you wouldn't believe what Julie did. I'm so excited. Let's get this moving.
Around 2.5 weeks after the letter was sent, somebody from the insurance said, we don't understand where the confusion is. We never said that you couldn't get your infusions. It was like, finally, something's going to go right.
The patient and the insurance company have a contractual relationship. That patient sends in an appeal. They have 72 hours to get back to them on an urgent appeal. And it's successful. It works.
How do you get to decide what's good for my life and what's good for my quality of life? My son-in-law is a Marine, and my oldest is getting ready to have another baby. I wasn't expecting grandbabies, and now I got a bunch of them. So I don't want to miss out on any of that because insurance doesn't want to okay my infusion, and it's just not fair.
Health insurance in the United States of America is the biggest scam in the history of the United States of America. That's got to change. It's got to change.